Hello, everybody. I'm Kayla Coe, and these are my partners, Ashley Sullivan, Kelly Stanshill, and Andrea Ruiz. We are health education and behavior students at the University of Florida, and today we will be teaching you a little bit about dementia. We want to inform you on the symptoms, how to prevent it, and when you should talk to your doctor and try to ease a little bit of the stigma surrounding this harsh disease. We will begin by explaining some of the terminology, followed by an explanation of symptoms and their severity. We will have videos to watch, guest speakers, an interactive activity, and an individual questionnaire at the end to ensure understanding of the presentation. We will review the answers and allow for questions at the end. We hope with this presentation that you gain a better understanding of dementia and how it can be handled. What is dementia? Before we can explain what to look for when recognizing dementia, we must first understand what it is. To start, dementia is not necessarily a disease itself, though it is often referred to as that. It is a term used to describe conditions characterized by loss in neurological function, so a proper definition according to the U.S. Department of Health is dementia is the loss of cognitive functioning, which is thinking, remembering, and reasoning, as well as behavioral abilities to such an extent that it interferes with daily life. You end up suffering from loss of function such as language skill, visual perception, problem solving, self-management, and the ability to pay attention. There are several stages to dementia: mild, moderate, and severe. Your age and family history are usually the biggest determinants in whether or not you are at risk. Different types of dementia. So remember that we said dementia is not the disease itself, but it is characterized by disease that result in loss of cognitive abilities. So the few types of diseases that are categorized as dementia are Alzheimer's, dementia with Lewy bodies, vascular dementia, frontotemporal dementia, and mixed dementia. The most common one we see is Alzheimer's disease, which is a shrinkage of the brain, which leads to the difficulty of remembering and often causes depressive disorder. Around 44 million people worldwide suffer from Alzheimer's. This type of dementia has the biggest effect on people and alters brain function. This leads to behavioral change and causes those who suffer from Alzheimer's to have a hard time with other people. The next one we see is dementia with Lewy bodies. This is very similar to Alzheimer's as it can cause memory loss, but it is more often associated with diseases like Parkinson's and causes tremors and stiffness. This type of dementia comes with hallucinations and sleeping disorders. Next, we have vascular dementia, which is dementia associated with brain injuries. This can be caused by strokes, head injuries, or accidents. Most side effects of this disease are decision-making issues and memory loss. The next one is frontotemporal dementia. This is where the effects are isolated mainly in the frontal and temporal lobes. This is where your personality and behavior become affected. Your frontal lobe controls cognitive function, so those with frontotemporal dementia suffer from memory loss, but also loss of language skill, emotional expressions, and problem solving. The temporal lobe mainly controls hearing and speech, again associated with loss of language skills, and talking ability. Lastly, we have mixed dementia, which is when somebody suffers from more than one type of dementia. Some risk factors. The Alzheimer's Association has done research on the different risks associated with dementia. They have found that there is not one sole cause of dementia and is often the association of several factors. Most of the factors are not ones we can change, but there are some that we can have an influence over. While the greatest risk factor for anybody is age, dementia is not considered a normal part of aging. Just because you are getting old does not mean that you will have dementia. It just means that the chances are a bit higher as your mind and body age. Almost 40% of all people over the age of 65 suffer from some form of dementia. According to the Alzheimer's Association of Canada, for every 5 years after the age of 65, your risk of developing dementia doubles. The next risk factor is genetics. This is one of the stronger risks of dementia, and if you have a family history of it, you will have a much higher chance of developing it. There are two types of genes that doctors believe affect your risk: deterministic genes and risk genes. Deterministic genes are genes that guarantee a person will develop a disorder, though only 5% of cases are caused by them. One of the risk factors we have control over is alcohol and tobacco use. Excessive alcohol and smoking can cause brain damage, which can lead to dementia. Drinking with daily guidelines is fine, but constant and excessive drinking is an issue. Another risk factor we have some control over is cholesterol. This is the one where you might have high cholesterol run in your family, so you have it. But for those who do not watch what they consume and have low cholesterol are at risk of dementia. If you are middle-aged with low cholesterol, you are even higher at risk for it. Head injuries is listed because it's still important to take notice of, even though it is rare. But often a head injury can later cause somebody to suffer from dementia due to brain trauma. Here we will have our discussion question. We will call on people in the audience to respond and fill in the blanks. This is a few-minute interactive exercise with the audience to make sure they are understanding the information given to them. Early signs and symptoms of dementia. There are many symptoms to look out for in someone who may be suffering from dementia. The typical age for dementia to occur is 65, but it can also affect younger people. Early onset of the disease can begin when people are in their 30s, 40s, or even their 50s. With treatment and early diagnosis, you can slow the progression of the disease and maintain mental function. Dementia usually first appears as forgetfulness. To go a little deeper into what a situation may look like, and some examples of them can include having a flat mood even when it comes to things that they once enjoyed, misplacing items, having a difficult time with a task that usually comes easy to them but is taking some thought now, for example, like balancing a checkbook. Also having trouble naming familiar objects, changes in their personality, and loss of social skills, which can then lead to inappropriate behaviors, and also getting lost on trips that they are used to taking regularly, like running errands or visiting a family member that's nearby. We'll have a discussion question. If any of you have had a family member suffer from dementia, what was one of the signs that stood out to you? Dementia as it worsens. Dementia can and usually does worsen over time. When this happens, the symptoms of the disease become more obvious and start interfering more dramatically with the individual's everyday life. Some of the symptoms may include more difficulty with reading or writing, using wrong words or not pronouncing words or sentences correctly, or they begin to have poor judgment and cannot recognize danger like they should, and they also start having a violent behavior and hallucinations. They have difficulty with basic skills like cooking, driving, and choosing clothing, and in severe cases can even have trouble eating, bathing, recognizing family, and understanding language. At this time, we will have a role play activity that will take about 10 minutes. Some helpful ways to cope. Informing yourself about dementia and the effects it can have on your life will give better insight of the days to come. Talking to a family member, counselor, or a member of your spiritual community is a way to discuss the feelings associated with the disease. Staying active is not only a way to cope, but it helps your body in many different ways. Find exercises that interest you and try to find classes that way you can be involved socially as well. Finding new ways to express yourself can be a great way to cope too. For example, painting, writing, or singing. Treatment for dementia. Recovery is unfortunately not always an option with dementia. It depends on the cause of it as well as the stage you're in. With advanced Alzheimer's, there is no cure, and if you're in the late stages, chances are there is not any help. While there is no cure, and no way to slow progression of the disease, there are medications that can help this. Medications. Dementia is a neurological disorder and causes a disruption in the communication of neurons in the brain. Dementia destroys those neurons, so when they cannot connect and carry information between cells, most of these medications stop the breakdown by the disease. The drug used to treat Alzheimer's are the same to treat other types of dementia. They are called cholinesterase inhibitors. They prevent the breakdown of acetylcholine, which is a chemical in the brain used for memory and nerve cell communication. The three different types of cholinesterase inhibitors are donepezil, galantamine, and rivastigmine. They can all be used to reduce symptoms at the mild to moderate level stages of dementia. Donepezil is used primarily to treat Alzheimer's in any progressive stages. Memantine, is a mix of donazepam and the drug memantine and is used to treat severe cases of Alzheimer's. It improves memory and attention spans. It regulates glutamate in the brain, which aids processing, as well as improved mental function for daily activity. Using non-drug approaches include occupational therapy. It modifying the environment and simplifying tasks. An occupation therapist can teach coping behaviors to prevent accidents for things like falls, and they can make your home safer and prepare you for the dementia progression. By modifying the environment, you make the home become a place with less clutter, danger, for example, like knives and car keys, as well as noise to make it easier for someone with dementia to focus and function. To simplify tasks, you are breaking tasks down into easier steps. Keeping things positive and focusing on success rather than failure makes this hard time a little easier for the person. Having a routine also helps reduce confusion. When should you seek help? When it comes to a disease as progression in dementia, you want to try and get a diagnosis as early as possible. This way you can seek early treatment and slow the progression as much as possible. Catching the disease early allows for slow progression and keeping yourself intact enough that the side effects do not alter your life in such a severe way. When should you be tested? If you are over the age of 50 and start to notice 10 warning signs, you should talk to your doctor. According to the Alzheimer's Association, the 10 early warning signs are memory loss. 1. Memory loss disrupts daily life, which is not you forgetting a few details or forgetting to get eggs at the store. It is much more serious, like forgetting you are even at the grocery store. The second one is challenges in planning and solving problems. Sometimes dementia can cause a person to have difficulty working with numbers in dense situations. If you notice you are having a hard time with bills or bank statements, it could be a sign of dementia. Number 3, difficulty completing tasks. This is just finding yourself struggling to do things in familiar situations, like picking up around the house and not knowing where something goes. Number 4, the next is confusion with time or place. If you're losing track of dates or seasons, it is important to talk to your doctor. Number 5, trouble understanding space. Vision problems are a symptom of dementia, and not having spatial awareness are all beginning signs of dementia. Number 6, word problems. A beginning sign is if you are starting to lose track in conversations, not just being confused, that happens to everybody, but if you are seeing that throughout the day, you are in the middle of a conversation and do not know what is happening. Number 7, misplacing things. Putting things in unusual places or forgetting where something belongs in your home. Number 8, poor judgment. Decision making is one of the subjects most affected by dementia, and it is a more serious warning sign. If you find yourself spending a lot of money or being reckless in life. Number 9, withdrawal from social activity. Not being able to hold a conversation makes somebody insecure and you begin to pull away from social interactions. Number 10, changes in mood and personality. Finding yourself having mood swings or being confused and depressed are all severe warning signs, and you should talk to your doctor right away. Although most of these seem like the symptoms rewritten, it is important to know the early warning signs before you have a diagnosis in order to protect yourself. Preventative action. Now that we know the symptoms, the signs, and how to treat dementia, we can learn a bit about how to prevent it. We know that there is no cure and there is not anything you can do if it is your genetics, but you can slow the progression and prevent extremity of the disease as best as you can. First, don't drink excessively. Remember that excessive alcohol use leads to brain damage, which can lead to dementia. Same with smoking. The chemicals and toxins in cigarettes cause brain damage, and amongst tons of other diseases, dementia. Stay in shape. This does not mean to go out and lose a bunch of weight, but make sure you eat healthy and are getting your heart rate up 3 to 4 times a week. Next, be social. Everybody needs social interaction to keep their brain healthy. Scientists have proven that being around other people actually trains our brain to improve memory and recall. Try and do some mental puzzles. These keep the brain stimulated and allow for memory formation, as well as protect the brain from diseases like dementia. Reducing the stigma. There is a very real stigma for older adults surrounding dementia. A stigma is a negative label on something based on unawareness and information. There is a significant amount of misinformation about dementia. That you will lose your friendships, that you are crazy, that you are stupid, that you are dying, all of which are not true. Unfortunately, because of these, people are afraid of the diagnosis. Many people will not get tested because they believe that if they have dementia, that they are losing their mind and they will lose their families. Let's debunk this. You should seek treatment if you think that you have dementia so you can get ahead of the disease and help yourself. You are not crazy or senile if you are diagnosed with this. It is not contagious. It is okay to be friends with somebody who has dementia, and honestly, it would benefit them greatly if you remained their friend, as social interaction could actually help them. This is where we will have our guest speaker, Melissa Armstrong. She will speak for about 15 to 20 minutes. Our conclusion. With this presentation, we have provided accurate information as to what dementia is, who is at risk, how to stop it, and how to treat it. We have provided information of local doctors that you can talk with if you feel that you are at risk. With our hands-on activity, you learned how to properly assess the symptoms of somebody who is at risk. With that activity, you also learned when it is appropriate to see a doctor based on your symptoms. With the help of our lovely guest speaker, Dr. Melissa Armstrong, all our points were reiterated, and you got first-hand recounts from a doctor who sees this disease every day. Throughout the presentation, you were all able to successfully answer our discussion questions, showing you are grasping the information and in turn helping us and yourself. With all of the information in this presentation, I hope you are able to put it to good use and keep yourself safe and aware. With that, we're going to hand out a questionnaire with 10 questions that we would like for you to answer and leave on the table on your way out. We appreciate your time and hope you had a good day as we did. Thank you.